RADx is short for Rapid Acceleration of Diagnostics and was an initiative launched by NIH to speed innovation and testing for COVID-19 approaches and strategies. The initiative has resulted in enhanced testing capabilities, improvements in diagnostics and detection, and strategies for reaching underserved and vulnerable populations, all of which can help address and inform future pandemics. Under the RADx initiative, there were 4 programs that served as data coordinating centers, or DCCs, that helped organize and manage the studies aligned to them. Each of the studies were collecting and analyzing data on a wide variety of COVID-related research and technologies. We're going to cover the 4 programs listed on the left side of the graphic more in a later slide, after we cover the rest of the graphic to the right. So the RADx Data Hub is a data repository that was established to support researchers in accessing de-identified and curated COVID-19 data and allowing them to aggregate and perform data analyses in a secure, cloud-enabled platform. The hub contains both standardized and harmonized data to the Common Data Elements, or CDEs, that facilitate cross-study comparisons and analyses. It has incorporated RAS, which is Researcher Auth Service, that provides authentication and authorization for RADx users. It also has a researcher workbench to work with the data within the hub. So each of the 4 RADx programs collected a wide variety of data and had different research objectives. Starting at the top is RADx Up, which stands for Underserved Populations, and is a coordination and data collection center, or CDCC, under the RADx initiative. It aimed to understand and reduce COVID-19 health disparities for underserved and vulnerable populations, such as racial and ethnic groups, rural populations, LGBTQ, older adults, and those experiencing homelessness, to name a few examples. Next is RADx Radical, or RADx Rad, which is a data coordinating center, or DCC, focused on non-traditional and innovative diagnostic approaches to address gaps in COVID-19 testing and surveillance. The next DCC is RADx Tech, which aimed to speed innovation for the development, validation, and implementation of COVID-19 testing strategies. Then there is RADx DHT for digital health technologies, which use smartphone apps, wearable devices, and surveys to trace and monitor infected and potentially infected COVID-19 participants. The RADx Data Hub has data from over 150 studies from RADx Up, RADx Rad, and RADx Tech. Please note that there are additional studies forthcoming as we are currently reviewing recent submissions, so the numbers will continue to grow. For RADx DHT, the data for the 10 DHT studies are stored in a separate data repository called RAPIDS, and there are links to the RAPIDS repository directly within the RADx Data Hub. All data that are contained in the RADx Data Hub are available for request for secondary research and have been de-identified, curated, and harmonized to the RADx Common Data Elements to facilitate cross-study analyses. Authorized researchers have access to a wide array of different health data types for COVID-19 data, such as clinical, behavioral, and survey data, diagnostic and testing results and images, and self-reported demographics and symptoms, to name a few examples. To work with the data within the RADx Data Hub, users have access to a cloud-based analytics workbench that they can use to merge, parse, analyze, and visualize data. The workbench is powered by Amazon Web Services, or AWS SageMaker Studio, and has several tools available, such as Jupyter Notebooks, Python, R, TensorFlow, and PyTorch. Users can access their approved RADx data files and also upload their own data to the workbench. There are additional tools that are available through an application and request process, which are SAS and Data Wrangler. Applicants for either of these tools are reviewed by NIH and are limited in the number of available seats. Interested users will be able to apply for access to SAS or Wrangler by completing the form in the Data Hub.